I'm about to reveal something that may shock you. At first, it might sound completely backwards. In fact, it may go against everything you've ever been told about supplements, vitamins, and what it means to take care of your health. But I want you to stay with me until the very end, because once you understand what I'm about to explain, it will make perfect sense. And more importantly, this information could save your life. My name is Dr. Sarah. After spending more than 20 years working as a cardiac surgeon, I've seen patterns that most people never see. I've looked directly at the inside of the human heart. I've examined arteries, valves, and blood vessels in thousands of patients. And there is one frightening pattern I keep seeing again and again, something that still keeps me awake at night. I see patients come into my office whose bones are incredibly strong. Their bone density scans look excellent. Their spines are solid. Their hips are strong enough to support them for decades into the future. On paper, their skeletal health looks perfect. These are not fragile people. These are not patients with weak bones or obvious deficiencies. But then, I look at their hearts. When I examine their arteries, what I see is deeply disturbing. Instead of flexible, elastic blood vessels that can expand and contract with each heartbeat, I see arteries that are hard, stiff, and calcified. They look like stone pipes. Their heart valves, which are supposed to move freely and smoothly, have become rigid and inflexible, almost like they've turned to rock. And here is the part that haunts me the most. These patients didn't ignore their health. These were not reckless people. These were not people who refused medical advice. These were the good patients. They listened to their doctors. They took their supplements exactly as instructed. They swallowed their calcium pills every single day. They took their vitamin D faithfully every morning. They were told this would protect their bones, and it did. But no one ever told them that the same calcium strengthening their skeleton could also be silently hardening their arteries. No one ever explained that vitamin D, when taken alone, can act like opening a floodgate without controlling where the calcium ends up going. What I'm about to share with you goes against much of what you've probably been told about these so-called safe supplements. Most doctors don't talk about this, not because they're trying to hide something, but because many of them don't understand the full picture themselves. I do understand it, because I've seen it with my own eyes, patient after patient, heart after heart, and I refuse to stay silent any longer. By the end of this video, you'll understand exactly which 5 mistakes are turning vitamin D into a slow-acting danger. You'll understand why these mistakes are especially dangerous after age 60. And most importantly, you'll know exactly what you can do starting today to protect yourself. This is not fear-mongering. This is life-saving truth. Please stay with me, because what you're about to learn could literally add years to your life. Arthur's story. Arthur was 72 years old when I first met him. He was sharp, intelligent, and mentally alert. A retired accountant who still did taxes for his friends and family. He walked 3 miles every morning without fail. He ate his vegetables. He avoided junk food. He did everything he believed was right for his health. For 8 years straight, Arthur took supplements exactly as prescribed. Every single day, without missing a dose, he took 1,000 milligrams of calcium and 2,000 international units of vitamin D. His doctor told him this routine would prevent osteoporosis, keep his bones strong, and protect him from fractures. And it worked. Arthur's bone density scans were excellent for a man his age. He never broke a bone. He never suffered a fracture. From a bone health perspective, the supplements were doing exactly what they were supposed to do. But then Arthur began experiencing symptoms. He started getting short of breath when walking upstairs. He felt pressure in his chest during physical activity. He noticed he couldn't do things as easily as he used to. His doctor ordered an echocardiogram, an ultrasound of the heart, and that's when we saw the real problem. Arthur's aortic valve, the main valve that controls blood flow out of the heart, had become severely calcified. The flexible leaflets that should open and close smoothly with every heartbeat had become stiff and rigid. They had essentially turned to stone. The valve wasn't opening properly anymore. Blood couldn't flow out of the heart efficiently. Arthur's heart was forced to work harder and harder, pumping against a valve that was partially closed. Arthur was shocked. He looked at me and said, "Doctor, I've been taking my supplements. I've been doing everything right. How did this happen?" That's when I had to explain something that most doctors never explain. Vitamin D acts like a gatekeeper. Its job is to open the gate and allow calcium to enter your bloodstream from your food and supplements. And vitamin D is very good at doing that job. When you take vitamin D, it signals your intestines to absorb more calcium. The calcium floods into your bloodstream. Suddenly, your blood is full of calcium. But here's the problem. Once calcium is in your bloodstream, it has no direction. Calcium doesn't know where it's supposed to go. It doesn't know that it belongs in your bones. It doesn't know where the parking garage is. So it starts depositing wherever it can. It sticks to artery walls. It settles in heart valves. It accumulates in kidneys, layer by layer, month after month, year after year, until arteries become stiff pipes, until valves become stone doors, until kidney stones form. This is exactly what happened to Arthur. 8 years of calcium flooding into his bloodstream with no one directing traffic. 8 years of calcium parking where it didn't belong. And the missing piece was vitamin K2. Vitamin K2, the missing traffic cop. Vitamin K2's only job is to direct calcium. When K2 is present, it activates proteins that escort calcium into your bones and prevent it from depositing in your arteries. Without K2, those proteins remain inactive. There is no traffic cop. Calcium parks illegally everywhere. This is known as the calcium paradox. Strong bones, but a weakened cardiovascular system. Research clearly shows that people with higher K2 intake have significantly lower rates of arterial calcification and heart disease. Yet most people over 60 are deficient in K2 because it's found mainly in fermented foods and certain animal products that most people don't eat regularly. Taking vitamin D and calcium without K2 is the first critical mistake. Mistake number 2, vitamin D without magnesium. Betty's story illustrates the second mistake. Betty was 65 years old and vitamin D deficient. Her doctor prescribed 5,000 IU of vitamin D daily. Within 2 weeks, she began experiencing heart palpitations and severe leg cramps at night. She thought she was allergic to vitamin D. She wasn't. She was magnesium deficient. Magnesium is required to activate vitamin D. Without it, vitamin D drains magnesium stores even further, leading to heart rhythm issues and muscle cramps. Once magnesium was added, her symptoms resolved. Taking vitamin D without magnesium is the second critical mistake. Mistake number 3, taking the wrong type of vitamin D. Vitamin D2 and vitamin D3 are not the same. Vitamin D3 is the form your body naturally produces from sunlight. It raises blood levels efficiently and stays active longer. Vitamin D2 is inferior and far less effective. Always choose D3. Mistake number 4, taking vitamin D without fat. Vitamin D is fat-soluble. Taken without fat, much of it isn't absorbed and passes through your body unused. Taking it with food that contains fat dramatically improves absorption. Mistake number 5, taking too little vitamin D. The recommended daily allowance is outdated. Most deficient adults need 3,000 to 5,000 IU daily to reach optimal blood levels. Lower doses are often ineffective.